Hey guys, this is the terminology for Anatomy and Physiology 2 for Lab Practical 2, which is blood vessels and respiratory. Now, we're not going to go through all of the vessels in the respiratory because I do have already a video of like this flat model here. But there are a few other models that I did want to show you as far as blood vessels, so that you'll want to take a look at. So let's start with the respiratory, and then we'll just do some of the models for the cardiovascular, for the circulatory. Okay, so here's the nose here. This is the half model here, half head model. Here's your conch here, and so this is the nose, and then as we move in, you have this cavity that goes all the way from here all the way to the top of the esophagus. This is the esophagus here. So basically, from this point to the level with the uvula, this is the nasopharynx. This cavity is the nasopharynx, and then from the edge of the uvula to the top of the epiglottis here, all this area here is the oropharynx. And then finally, from the top of the epiglottis to the top of the esophagus, where the esophagus would start, this area here, this cavity here, is the laryngopharynx. So again, nasopharynx, oropharynx, and laryngopharynx. And this is the epiglottis, false vocal cord, true vocal cord. All this is the larynx, and then your esophagus back here. Hard palate, the pink is the soft palate, and then this yellow is the uvula. And there's a couple other things, just FYI. Here's the adenoid, or the pharyngeal tonsil, and this is the palatine tonsil here. And that is, and then after that would be the trachea. So what we actually see here is the larynx, and then after that would be the trachea. So that's all for this model here. Again, here is the lung model here, and this is the larynx, hyoid bone larynx. But this cartilage is called the thyroid cartilage. This is the thyroid cartilage, and then right in here you can see a little bit. This is the cricoid cartilage. So thyroid cartilage, cricoid cartilage. The whole thing, the whole structure is called the larynx. Here's the trachea. See these cartilaginous C rings. Here's the trachea. And then what we see here, the first two branches then. This is the left primary bronchus and the right primary bronchus. And then we see secondary bronchi, and we see 1, 2 for the two lobes here. Secondary bronchus, and then we see tertiary bronchi, and bronchioles. The lobes of the lungs, you can remember 3 and 2, just like tricuspid and bicuspid in the heart. It doesn't have anything to do with it, but it's just a good way to remember. So you have 1, you see a fissure, 2, second lobe, and you see another fissure here, third. So this would be the superior lobe, so you could say the superior right lobe, middle lobe, and inferior lobe. And you can see those fissures separating the lobes. Whereas over here, just like you'd have bicuspid, over in the heart, you have 2 lobes, so superior and inferior lobes. this thing could be just sitting by itself, so then you remember, okay, this is the left one, and there's two of them, two lobes, so superior and inferior. Here's another model of the trachea and the bronchi. So trachea, and this is the right primary bronchus, left primary bronchus, secondary bronchi, secondary bronchus, and then what we'd see here, these would be tertiary bronchi, these colored ends there. So that's all that we can show with as far as respiratory. And of course, with the pigs, you can see the epiglottis and so on. Okay, so here we got some blood vessels here. Since these are kidneys here, this is the abdominal aorta, and this is the inferior vena cava. And you see a little trunk there. There's 1, 2, 3 vessels coming superiorly off of the aorta. Therefore, this is the celiac trunk. This is the superior mesenteric artery, and this is the inferior mesenteric artery. And then the two coming off the sides, these would be your right and your left gonadal arteries. Or you could say right testicular artery or right ovarian artery, if you know the sex. These would be your right renal artery and right renal vein there. And we go over here, we can see, again, here's the abdominal aorta. Up here, here's the thoracic aorta. You got your diaphragm here. So the diaphragm will separate. All of it is descending aorta. But this would be the, more specifically, thoracic aorta and abdominal aorta. Here's your celiac trunk. So celiac trunk, superior mesenteric artery, inferior mesenteric artery, and then your gonadal that you see there. This is the left common iliac artery. Left common iliac artery. And this is the left external iliac artery. And this is the left internal iliac artery. And this is the inferior vena cava. So this is the left common iliac vein, left external iliac vein, left internal iliac vein. As we work our way up here, this is the superior vena cava. Therefore, it looks like we got a vessel here and a vessel here going up. Therefore, this must be the left brachiocephalic vein. Left internal jugular vein. Left external jugular vein. And then in between, that's the left subclavian vein. And then what is after that? This area and this area here. That would be the left axillary vein. Okay? This is the right brachiocephalic vein. And if this is the first vessel here, then this is the, you wouldn't say left or right, you would just say brachiocephalic trunk, brachiocephalic artery. If that's the first one, this is kind of. As we make our way up here, here's another model. And if this is the left common carotid artery, then we can see the one that's closer to the mandible. That would be, you see how you can see the end there? That would make this one the left external carotid artery, and this one will be the left internal carotid artery. How can I tell? Because this one disappears into the head, where this one, you can see the end of it feeding the outside. So that would make that the external, and this would be the internal. Okay, and then again here, you see the same thing. Left, this would be the left common iliac artery, left external iliac artery, left internal iliac artery. And you can do the same thing with the veins. All right. Thank you guys very much, and study well.